Living Health is Highmark's strategy that starts with a digitally enabled care model at the center. So think about all the kinds of things that could go wrong with a person, whether that's chronic diseases, behavioral health conditions. How do we integrate ways of helping those people to stay healthy or manage those conditions through what we would say are newer, non-traditional virtual and digital means?
Virtual health is a new name for what we used to call telemedicine, and it can be anything from remote patient monitoring where a patient has an at-home device that can send information to their doctor, or it could be a video call to your doctor where you can chat and talk about your health care and actually get a physical exam.
Interestingly enough, Highmark was committed to accelerating our virtual health strategy even before the COVID pandemic.
Then all of a sudden the pandemic hits, right? Everyone's calling like, hey, what was that device you said you would use to be able to look in someone's eyes when you're not even in the room with them? When I travel for work, I can still see my patients that are back in Kentucky. I can listen to their heart and lungs. I can look at their eyes, ears, nose, and throat with Bluetooth technology. I can get an EKG from here.
There's a recognition in the industry that these are the issues that are facing us. As a company, you always have choices. You can try and preserve the status quo, or you can choose to lead. And we at Highmark believe that we are uniquely positioned based on our assets as well as partnerships that we have.
One of the innovative things we have is a diabetes management system that the patients will get a glucometer as well as an app to be able to check their numbers and manage their diabetes on a more regular basis. This device is a fiber optic scope to look in the ears. Cheap device, less than $50. This is a watch that checks sweat glucose. It can check salt in your sweat, like for cystic fibrosis. It can check heart rate, temperature. That kind of stuff is invaluable. Not only does it give you direct access, it also gives you the ability to pick and choose when some higher level of care is necessary or not. Because let's face it, the main problem in healthcare is getting people to the right level of care at the right time.
Living Health really benefits everybody in the healthcare value chain. When you are developing a better healthcare model for people and for clinicians, you're doing it for your mother, and you're doing it for your child, and you're doing it for your spouse and your friends. Healthcare is very personal. And if we can leverage the technology that we have available to us in the world that many, many other industries have leveraged very successfully, that's a win for all of us, because our friends and our families and those people that we love are going to be healthier as a result.